Hello friends, today we are going to talk about a very important and recent approval by US FDA, that is Losartan Potassium Oral Suspension, which has been recently approved on 13th March this year. And Losartan is an angiotensin 2 receptor blocker, that is ARB, which is widely used for the treatment of hypertension and certain heart related conditions. So, conventionally, losartan has been available only in the tablet form, mainly for adults and children aged more than 6 years who can safely swallow the tablets. However, younger patients, especially those around 6 years of age, or the individuals who have difficulty swallowing pills, such as elderly patients, stroke survivors, or patients with certain medical conditions, often require a liquid alternative. So, why the need for this oral suspension? Until now, if a patient could not swallow a losartan tablet, the available solution to this problem was to manually crush the tablet and mix it with a liquid, a process called extemporaneous compounding, to create an ad hoc suspension. Tablets are designed for oral solid delivery with special coatings and structures. Crushing can destroy the tablet's design, leading to fast and unpredictable absorption or the loss of drug during this compounding process. Plus, uniform distribution of the active ingredient is difficult when crushed, so each spoonful may not have the correct dose. So, what are the different problems with this crushing or compounding the tablets? Number one, it is inconsistency. Yes, crushing can lead to uneven distribution of the drug, causing inaccurate dosing. Some doses may be too strong and others too weak. And the second issue is stability. The crushed product may not be chemically stable for long, leading to loss of potency. Third point is safety. There is risk of contamination or errors during manual preparation. And the next point is convenience. Compounding requires time, effort, and expertise. It's not easy for patients or caregivers at home. Compounded liquids are also usually unstable. They can degrade in a few days if not stored properly. Whereas this oral suspension form, or we can say these industrial suspensions, solve these problems by providing a homogeneous, stable, measured formulation. Thus, a ready-to-use oral suspension of losartan has been developed to address all these challenges. So, what are the different advantages of this losartan oral suspension over the conventional tablets? Number one, ease of administration. Yes, because it is especially helpful for children, elderly, and patients with swallowing difficulties. And second benefit is accuracy of the dose, because pre-measured liquid formulation ensures precise dosing without the risk of under or overdosing. And the third advantage is safety and convenience, because no need for crushing or compounding at home or pharmacy. This reduces the risks of errors, contamination, and inconsistencies. And the fourth benefit is storage. Yes, because the oral suspension has a long term shelf life even at room temperature, making it practical for regular and long term use. And the next benefit is reduced dosing volume. The new suspension is concentrated, meaning a smaller amount needs to be taken for a required dose. So there are certain common side effects which are similar in both tablets and this new oral suspension. So these side effects are dizziness, headache, fatigue, nasal congestion, and hyperkalemia, kidney function changes, etc. So if we have mentioned hyperkalemia, so let's discuss an MCQ based on this problem of hyperkalemia due to ARBs. So here is an MCQ. A 45-year-old woman is started on losartan oral suspension after experiencing uncontrolled hypertension. A few weeks later, she reports symptoms of muscle weakness and palpitations, and laboratory findings reveal hyperkalemia. So, this hyperkalemia observed in this patient is most likely due to option A, blockade of beta adrenergic receptors. Option B, inhibition of angiotensin 2 receptors, reducing aldosterone secretion. And option C, direct stimulation of the sodium potassium pump. And option D, increased renal potassium excretion. So here option B is correct. There is inhibition of angiotensin 2 receptors reducing aldosterone secretion. Because the explanation is angiotensin 2 stimulates the adrenal glands to secrete aldosterone. Aldosterone promotes sodium retention and potassium excretion by the kidneys. When losartan blocks this angiotensin 2 receptors, aldosterone secretion decreases. As a result, less potassium is excreted and potassium accumulates in the blood, leading to hyperkalemia. So yes, we were talking about the side effects. So the type of side effects remains the same for both dosage forms because the active drug, that is losartan, is the same here. However, because the oral suspension ensures more accurate and consistent dosing, it may reduce the risk of side effects caused by overdosing or underdosing seen with manually prepared liquids. This new Losartan potassium oral suspension is the first liquid formulation available directly from the manufacturer. So no crushing is needed here. This is accurate, stable and safe, convenient for both the patients and caregivers, and also with longer shelf life. Thus, it represents a significant advancement in the delivery of losartan therapy, particularly for pediatric and special needs populations. So now let us discuss what are the different indications of this losartan therapy. It is used for the treatment of hypertension to lower blood pressure in adults and children more than 6 years old. And here, lowering the blood pressure reduces the risk of fatal and non-fatal cardiovascular events, primarily strokes and myocardial infarctions. So yes, this is also an important indication. There is reduction of the risk of stroke in patients with hypertension and left ventricular hypertrophy. Treatment of diabetic nephropathy with an elevated serum creatinine and proteinuria in patients with type 2 diabetes and a history of hypertension is also a very important indication of this losartan therapy. Now here is an important safety information to pregnant ladies. It can cause fetal harm when administered to a pregnant woman. Use of drugs that act on the renin-angiotensin system during the second and third trimesters of the pregnancy reduces fetal renal function and increases the fetal and neonatal morbidity and death also. So do not take this losartan preparation when pregnant. When pregnancy is detected, discontinue this losartan preparation as soon as possible. Drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. And this losartan potassium oral suspension is indeed expected to be available in the third quarter of this year 2025. So this was all for this today's short but important video, and soon I will be back with the next important and interesting topic. So stay connected and thanks.